We are excited to feature the School Health Services Equity Leadership Team of Leslie Valentine, Clarissa Jimenez, and Miguel Claxton. They've been working on ways to bring more equity into everyday school health practices, and one of their newest efforts is a Health Room Interaction Equity Lens tool. This tool supports staff in making fair and thoughtful decisions for students each day. We sat down with Clarissa and Miguel to listen to their experience in designing and implementing this tool.
The tool is basically an approach, how the nurses interact with the students, and in a way that they are dealing with the whole student. As they come into the health room, they're dealing with making sure that the student is seen and heard for who they completely are. Meaning from how the student identifies, how the student culturally identifies, where they come from, to be sensitive and to be in a space where that is taken into consideration when we're giving the care that we need to give as nurses.
Yep. Nurses and health assistants.
And health assistants.
Well, it all began when me and Miguel were asked to, if we were interested in joining the equity leadership team and also talk about curriculum or just information that we can touch base on with our school health services department. And really, I think across 2 years is what it took to get to this point, because at first it was having presentations with our administrative staff and nurse supervisors here in this building, and then that turned into having in-service presentations with our health assistants and nurses. And we were inspired by the Centennial School District equity slides that they used based on the ODE modules on equity. So we looked at the information, the content, and then thought, how can that apply to nurses and health assistants when they show up for our students? And with every presentation that we would have debriefs after and hear the feedback of our staff, and then think, okay, how can this turn into action? Not just talk, not just reflection, but how can we create something that is useful in our day-to-day and how we show up for students?
One of the things that we saw is that there wasn't a tool for us, that there wasn't an approach that nursing had or the school health assistants had to approach in a way that the consideration was being done. Like the modules were for the teachers or for the educators. So we had to translate that into something that was useful for the health room. When the students come, we are part of the system that's trying to keep the children in school and trying to get that bridge where the communication and the children are being seen, the students are being seen and being taken care of in a holistic way. Staff input was the number one thing, because a tool is a tool if it's used. If it's not used, it's just gonna take up dust. So one of the things that Clarissa, myself, and Leslie did was we wanted the participation of the staff so that they knew that they were the ones that were creating the tool. Not us, they were the ones creating, because they are the ones that are out in the field. They have the experience, they have the know-how, and they have both the positive and negative experiences that have happened in the field in this way so that they could share and kind of build from that. And we would take the data and take the information and collaborate with the whole team, both the SHAs, all the nurses, which, by the way, I want to give thanks to our leadership who gave us the ability to bring the nurses in and the SHAs in for all these in-services, because it does take a lot of resources to do this.
There were certain themes that came up when we asked nurses and health assistants about their day-to-day care in the health room. So when these themes came up, we would do activities where we would ask them to reflect on, for example, what it means for them when we say focus on the whole student, building connection over compliance, student-centered care, creating a safe and inclusive space in the health room, and then taking time to reflect and respond. So those were the themes that came up. We had an in-service where we had them break that down, give us concrete examples of what that means to them. And we would have activities in which they would write their ideas, we would put them on the walls, and we'd all have a debrief together to say what stood out. And it was beautiful to see colleagues be able to share about their day-to-day and learn from one another, be vulnerable and recognize the challenges that they may face. And so after that in-service where we had that discussion, we then basically helped summarize those concrete examples in our full equity lens document and then in our badge, so that people can reference that and take a pause to consider reflection and what questions they can ask of themselves to provide care that is continuous and is human, and removing any bias as much as possible.
One of the things that the tool does is that it asks when you have an experience, whether it be challenging or something, a breakthrough that you have, to communicate it back to the ELT. That way we can build, or it becomes a live document where if we need to adjust, we can adjust, or we can see better best practices and how they work. So this is something that has to be ongoing. It's not just a one and done. This is work that's continuous.
So at the last in-service, we did communicate with staff that this was the goal, that we wanted to actually develop something concrete. Over the summer, there was some meetings that Leslie and myself had to put it all together, finishing touches, and then our administrative staff supported with the lamination of these badges, and Leslie and I worked on the document and just finessing it. And Leslie has communicated with her colleagues and our supervisors and handed them the badges and the link to the full lens so that they can bring that up at partnership meetings or develop their process for sharing this information with their staff.
And partnership meetings are the meetings that each supervisor has with the nurses and staffs that they supervise. So we have not only, it's like pods, so the information is being disseminated and always discussed.
When I think about this, I think about our partnerships that we have with other education service districts in the state. We have the School Nurse Association that has a website and resources that at times have been implemented or used from our organization, if that makes sense. So I can imagine that there's potential for us sharing this initiative and inspiring other education organizations to consider how they can also develop a tool.
What I also see is that not only the tool itself, but the process of how to do the tool can be implemented in almost any area that you would want to create something collaborative with the employees that you have. So this, for us, was an extremely positive experience where we were getting real-time feedback from the field, from the people who were doing it, and they felt part of what was going on. So not only can we do this tool, but almost anything, any problem that is a group, it could be set up where the group is the solution. Yeah. So, and this was a perfect example of how that works. And for this specific tool, I don't think there's anything in schools that is specific to nurses. So I can see this being a tool that could be used anywhere where you have students and health assistants and nurses. So I'm now in the field removed from the office, and so I'm using the tool myself. Okay, and as we were producing the tool, I was using it, and I'm also in contact with other nurses in the field. Um, this was maybe, if not a blind spot, a spot that we didn't know how to interact from a standpoint of having one voice or one way of doing it. And this gives people the clarity where they have sort of like a schema to work from. And with this tool, then we've created basically a vocabulary that we all know what is being said, because we had all the teaching that led up to doing the tool. Therefore, it creates a way of, when we approach and we talk about something, we can ask the questions that are pertinent to dealing with the student holistically. And that's part of the feedback that has been coming back, because at any given time, if you miss one aspect of the student when you're dealing with them, then you're actually missing the whole student.
I would like to add that there were several employees that were really excited to hear that we were going to have something for the badges, something that they can reference. And we recognize that in equity work and what we have witnessed in our efforts, there's a spectrum in which we all land in terms of the knowledge we have, the base knowledge, our experience, and then our willingness to learn more about equity. So when Miguel mentions just the process of getting here, in the beginning, we talked about what it meant, what we defined equity, we defined diversity, we defined inclusion.
Equality.
And people have a base knowledge, and then there was always room for improvement. And so this tool reflects that learning, and it also reflects that common ground of, okay, when we talk about equity, this is what we mean.
Mm-hmm. The reality is, the first thing that I looked at when we started this was what was the blueprint. Mm-hmm. I was in the military for 10 years, and one of the things that I learned when I was in the military is you have to work within the commander's intent. So the first thing that we did was we looked at the blueprint of what was going on in the mind of our leader to want to move the whole organization forward. It makes no sense to create a program that goes against the wishes of the leader. So we were looking at that and kind of trying to incorporate what the vision was from that and how it could tie in with the vision that we had for the tool that we're creating. And it's right in line, because the goal is to give the students the ability to have the traction to go forward, to move forward. Give them the tools, give them and this goes right in line. We want to make sure that with our nurses, there's an ability to deal with the student in a way that we give that opportunity.
And I think to model behavior, to model advocacy, to model this realization that we are lifelong learners, that we are all connected. And so when we talked about all this, it wasn't just how can we serve students, but also how can we show up in life beyond our roles as nurses. So I think it's a tool that can be applied when we're meeting people in the community. Mm-hmm. We're seeing them as a whole human. We are trying to build connection and not make assumptions. We're asking questions. We're curious. That came up a lot. Curiosity.
Yes, curiosity.
Many times we may be wired to just make certain judgments when we meet someone or when we have limited experience with certain groups of people. But curiosity came up as, let's just show up and see where this conversation goes. Let's show up and see how the student is doing today.
So that's basically how we looked at. From the beginning, we had that in mind to make sure that we stayed within the guidelines of what we were supposed to. One of the things for our group was We have to have the voice of everyone. Okay, and that's one of the things that we wanted, because it makes no sense for us to create a tool, us three, Leslie, Clarissa, and myself, and then say, here, use this. Where did that come from? How was that created? What experience do you have to tell us what to do? Okay, so what we did was we brought everybody in. And don't get me wrong, you're going to have resistance, because there's always resistance to learning things. And that's fine, because if you're going to have a group of people, you're going to have diversity. That's exactly what we were looking for, diversity. Believe it or not, from those people that were resistant, we actually learned things also. Mm-hmm. So we needed everyone's voice and everyone's input. And even input that was not to our liking was actually useful. It's that we use that also, because that shows a population that we also needed to shine the light in a different way.
For us, when we would have discussions, we always talked about relationships, right? And this was a bonding experience for us three, and to learn more about one another and what our passions are, what our growing up, what our lives were like. And so I think when it comes to relationships, that's the lesson of, it's all about communication and relationships. Because we wanted to build trust, we wanted to be transparent. We ourselves were vulnerable at the front of these in-services when we would describe why we're doing this work. And it was difficult to share that because at times there's feelings that come up, and we ourselves are still doing this work when it comes to equity, how we're showing up, checking ourselves on our own biases. And so I realized that even if I'm still a work in progress, I can still show up and do this work and hopefully inspire others and help them in the process. And that's how we create a better, not a better place, but just the growing, ever learning environment.
One of the things that we made sure that everyone that we were collaborating with, because it was a collaboration, is that we weren't leading from a place of expertise. We were learning. We would do research, we would learn, we would get together and then put the data together. We let them know we are facilitating. We're not instructing. And that's what we did. We facilitated a work group to get a tool done. Well, you can only lead with honesty, and you can only lead with understanding that you're putting your truth out there, you're putting your true self, and knowing that, yeah, these are uncomfortable subjects sometimes for people, but change only happens when things that are uncomfortable are dealt with. So we just had to go through whatever we had to go through and trust that the process was going to work. And I think it came out pretty good.
We kept going, and that even when we would face the resistance, we took a moment to really reflect and say, well, why is it bothering me? And also be understanding of people and knowing, yes, this is challenging for us. I can only imagine it's challenging for others, especially when they haven't received guidance on this, right? And so if we're able to share our experience, and if we're able to provide a space where the goal is not judgment, but rather true open communication, then that's something that I feel happy that we did, to just raise those voices and to also always advocate for students, and knowing that we don't know what students are going through, we don't know what our colleagues are going through, but we're pushing that message of, hey, let's just, work together, let's exist together, let's learn from each other, and let's build that community.
What I'm most proud is that we were allowed to do this work, because we couldn't have done it without our supervising team giving us the liberty to do it. And they gave us a lot of leeway to do whatever we would come up with, and they supported that. In order for it to happen, we were told, This is what we have. Do with it what you want. Do with it, take it in the direction that it takes. And then we were supported. Every time that we needed to have we would say to them, well, okay, we need the people to come in. We need, and they would find a way to get the nurses and the SHAs in for a training. We would find a way. Because if we didn't get the feedback, we don't get the buy-in. If we don't get the buy-in, the tool doesn't work.
There was also something initially when we started this work where we would talk about the needle not moving forward, because it started with courageous conversations about race, that curriculum, that book, and calling out how in education, right, sometimes these conversations just don't happen. And then if we don't talk about something that needs to be worked on, things stay the same. And so I'm proud that we had these conversations. And when we talk about, again, that resistance, that's opportunity to engage in that conversation to create an action plan for change. So many people in their equity journey may do a variety of things, right? Whether they show up for the community, whether they advocate in whatever form, educating themselves, having difficult conversations at home with their families. And this is one way that everyone who showed up was able to challenge themselves and take action.
And even though this was done for the school and for the students, I think that personally we all grew. And that in itself is something that I'm proud of. One of the things that happens when you go out into the field is sometimes you may feel alone. But there's always a group of people that's working to try to make the best support for you. I was part of the support team that was at Ainsworth for a little bit of time when we were doing the CD, when we were doing the equity work. Now I'm out in the field and I know what support I have in the back, and I want other people to know when you have a need, let them know, and they will come for you. They will help you. They will give you the things, the tools that you need. This is one of the things that was done. This is in response to, one, the needs of the students and the needs of the nurses that need to, and the SHAs that need to take care of the students.
I'd just like to thank our MESD community for all they do for students, all they do for one another, for showing up. I see the efforts everyone puts in amidst life's challenges, and it is important work, it is difficult work, but it is worth it to show up with an open heart, open mind, and trying to just make the world a better place within starting within our community and starting within ourselves.